Good afternoon. Thank you for joining today's field-wide webinar utilizing administrative data from process to implementation evaluation. I am Demetrius Thomas, Deputy Program Director at the Council of State Governments Justice Center. I will be moderating today's webinar, which is funded by the U.S. Department of Justice Bureau of Justice Assistance. To give you an overview of today's webinar, first I will introduce Dr. Faye Taxman, then I will do a brief overview of the Bureau of Justice Assistance, BJA, Council of State Governments, commonly referred to as CSG Justice Center, and the Justice and Mental Health Collaboration Program, commonly referred to as JMHCP. After that, Dr. Taxman will lead us into the presentation. After the presentation, we will have a discussion, and then after discussion, there will be a question and answer portion followed by a quick wrap up. We ask that for the discussion and question and answer portion that you either chat your questions and or raise your hand. We will acknowledge, once your hand is being raised, we will acknowledge you and then ask you to take yourself off from mute to ask your question and or your response. Anytime during the webinar, you can ask a question by clicking on the Q&A button at the bottom of the screen and answering your question. This includes both technical and content-related questions. We will try to reply to technical questions in the chat window as we go. For the content-related questions, we will keep a running list and address them at the end of the webinar. We will do our best to get through as many questions as possible. If you encounter technical or audio problems during this webinar, please click on the links dropped into the chat box. Please understand that there are some technical issues that may not be able to be resolved. We are recording the webinar and will post it on our website. Dr. Faye Taxman is the University Professor at the Schar School of Policy and Government, a health services criminologist. She is an expert in implementation and intervention sciences, where she has conducted various experiments to determine which processes will improve access to treatment and retention, and to formulate and assess new models of probation that is consistent with current evidence-based practices. Dr. Taxman is the founding director of the Center for Advancing Correctional Excellence, which conducts collaborative and creative research to bring evidence-based practices and treatment to practitioners and policymakers in the criminal justice and health fields. Next slide, please. Next, I'll provide brief overviews on the mission of the BJA and CHP Center and the Justice and Mental Health Collaboration Program. Also, just as a reminder, when you're entering the room or in the room, if you can please put yourselves on mute. Next slide, please. BJA's mission is to provide leadership and services in grant administration and criminal justice policy development to support local, state, and tribal justice strategies to achieve safer communities. Specifically, BJA provides funding to support law enforcement, combat violent and drug-related crimes, and to combat victimization. Through the development and implementation of policy, services, and sound grants management, BJA strengthens the nation's criminal justice system and restores security in communities. Next slide, please. I am going to give some feedback on the Council of State Governments Justice Center. The Justice Center is a national, nonprofit, nonpartisan organization that combines the power of membership association representing state officials in all three branches of government, with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. Next slide. This slide describes a bit more about our work style and how we strive to reflect Justice Center core values, which includes a commitment to being independent and nonpartisan in every aspect of our work, providing vigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Next slide, please. Today's webinar is part of the Justice and Mental Health Collaboration Program, again, commonly referred to as JMHCP, Training and Technical Assistance, commonly referred to as TTA, which many of you may already be familiar with if you currently have or had a JMHCP TTA grant. The JMHCP TTA promotes innovative cross-system collaboration and provide grants directly to states, local government, and federally recognized indigenous nations to improve responses for people with mental illness and or substance use disorders who are involved in the criminal justice system. Next slide, please. I am now going to turn it over to Dr. Faye Taxman, who's going to get us started with the presentation. Faye?
Thank you very much, Demetris, and welcome everyone this afternoon. So I want to start out by basically introducing a new research design called Implementation Effectiveness Studies. And the reason I want to do this is because most effectiveness studies look at client level outcomes and sort of don't pay enough attention to what actually happens in terms of inside the black box. But the new models that are being used now, called implementation effectiveness, basically combine a look at a fidelity of a program and the processes measures in order to help explain client level outcomes. So essentially, in our traditional studies, we typically look at, what type of people do well in what type of intervention. But the implementation effectiveness essentially says what type of people do well, how well is the intervention put in place, and what does that yield in terms of client outcomes. So, I wanted to present to you this particular framework of implementation effectiveness because it gives us a richness by which we can do our work, and it feeds into the theme of this particular webinar, which is administrative data. So you don't see administrative data on this slide, right? But the reason you don't is because most effectiveness studies that we do use administrative data. They use arrests, they use reconviction, reincarceration as the typical outcomes. And those usually come from some sort of source, such as police departments, corrections agencies, the courts, as a way of defining effectiveness. But the implementation measures are not necessarily in most of our administrative data sets. But I'm going to argue throughout this presentation today that you should begin to start thinking about that. And, as a way of really tying the question to be, how well does your implementation produce the types of outcomes that you really want? Now, I say this kind of tongue in cheek because, to be perfectly honest, for about the last 60 years, when we've said nothing works or it doesn't work that well, we usually are saying it really wasn't implemented, right? It wasn't put in place as we had hoped, and therefore that could help us explain the designs. So there's 3 types of implementation effectiveness studies. The first one is called type 1, and it basically tests some sort of intervention, right? And that intervention could be a police deflection project. It could be early release from jail for people with mental health issues. It could be, trying to dealing with some issues related to reentry or using some sort of instruments as a way of identifying who needs what type of care. And in hybrid type 1, the implementation information is gathered, but it's not necessarily integrated. It's really when we get to hybrid type 3, when we are testing how this was implemented, and then we look at the impact on client level outcomes. So I wanted to start out by just saying, there are new ways of beginning to tie together the fidelity of our efforts to put in place your grant programs, the process measures, and then use that to help us understand client level outcomes. And I've provided a citation for you from a National Academy of Sciences report. If you're interested in other information about this particular design, please let me know, and I'm always happy to share other goodies with you. Next slide. So, as you well know, a research design basically helps us focus in on testing the effects of something on a set of outcomes that we're interested in. In the implementation effectiveness design, we actually get to test the program impact as well as the implementation fidelity. And we do this in a way to see whether or not it's the program or fidelity that affect the outcomes on different relevant things of interest to you. So the research design that you select, and of course, the gold standard is a randomized controlled trial, but there are really also some high quality high quality quasi-experimental designs too. And what's important to keep in place is that the design you select can actually indicate whether you're type 1, type 2, or type 3 type of design in this new framework. Next slide. So I wanted to give an example here. Okay. A couple years ago, we did a hybrid 3 type of design. It was kind of before it was named Hybrid 3, but and the goal of that was to test how we could improve juvenile justice case managers to use information from risk and needs assessment tools. And we essentially had what's called a 3-arm study. We had 4 sites that were assigned to an enhanced group, and the enhanced group essentially they were assigned a juvenile justice expert. They did stress management. They did sessions helping officers learn to multitask. And they really focused their attention on helping people develop expertise in case management efforts tied to the risk and needs instrument that was used by this juvenile justice agency. The second condition we tested is what was called a standard condition. And in those standard conditions, it involved booster sessions that were offered over a year period of time, and they were really focused on education and skills of the officer. And then we had a third group, which was essentially a control group that just did business as usual. So the study was that we had these 3 conditions. Everybody got a 1-day kind of modified version of motivational interviewing. Everyone got a 3-day session on rapport building with youth and their families, using the risk need tool of choice, and how to do case management. And then, depending upon the site that people were assigned to, they received some type of follow-on sessions for over the next year. So unfortunately, because of the way this webinar is, you see the results here, so there's no surprise. But we were surprised because we actually thought that the standard conditions, which would be refreshing people's memory of what happened in the skill building, would have generated an impact. But in fact, it did not. It had no impact compared to the control group. The only model that had an impact was actually the enhanced conditions, where we put in place some juvenile justice experts, worked on the staff in the assigned offices in learning how to manage their workload and also to practice skills. And we actually saw that from an organizational perspective, we saw there was a greater commitment of staff and managers to the goals of the organization. There was more cohesion of goals. There was greater referral to services by the officers, greater service utilization, meaning kids went to the services and they continued to go for longer periods of time. And then also the case plans were more in line with the risk and needs assessment. And we got the prize of reducing recidivism and rearrest rates in these particular youths. So this particular study basically is a hybrid 3 because we were testing different ways of implementing the risk needs assessment tool and the case plans, and giving support to the officers as they begin to use it. For us, the surprise was that we were able to see improvements in the organization, as well as improvements in terms of reduced recidivism on the part of the youth in the study. So this is a very exciting study. I've included several citations for this particular study, but it kind of illustrates what an implementation effectiveness study does, which is to essentially look at the quality of the implementation and how something was implemented to have an impact. Next slide. So the issue that always occurs in, in any research design is the metrics that you want to use in your particular organization. So all of you are grantees, and you have probably a lot of different things that you desire to accomplish as part of your grant. But one of the things we want to highly suggest here is that as part of your implementation, you have a discussion with your team, the people that are working on your particular grant, about asking them questions about how are you going to measure implementation? How are we going to measure outcomes? And these are decisions that are unique to each program and priorities. We recommend that these discussions that you have, of course, you can always depend upon CSG to give technical assistance to help facilitate some of these discussions. But it's something that all of your partners should really agree upon. And when selecting these key metrics, you should look at collecting data at both the implementation and the individual level. I recommend what's called a mixed methods approach, doing some quantitative, and quantitative usually comes from your administrative data, but also some qualitative data through interviews and working with people in different scenarios, including some of the clients, to find out more about the program. The key is in any study, you got to prioritize in what direction you're going. And so this is why you need to get your group together so that you can really focus your attention on collecting the data that's most valuable to you in your particular jurisdiction. Next slide. Okay, so administrative data. Now, I'm using the term administrative data to essentially refer to your existing management information systems that can provide information about your particular areas of interest. And typically, this includes arrest or conviction data. It can include intake and discharge data, when someone enters a program or service and then when they leave. And it could also indicate some processing data, like if someone is engaged in different parts of the program, or they get other services like drug testing services, or they get a clinical assessment. And so, you have the opportunity to really think about what sort of data you would like and need for your particular grant. But one question you may want to ask is, are there other agencies that have relevant data that might be useful? So, for example, the issue is that and the behavioral health agencies might be able to give information about screening and assessment results, what treatment services people provide. And that's usually not maintained within a criminal legal system data set or management information system. The same thing with housing. Usually information about people's housing is also, is also quite relevant. And there's other places, for example, a lot of jurisdictions are now looking at Medicaid data, which basically gives you information about the medical services that a particular person has. So you don't have to just stay within the data that your agency collects. You can begin to think about how to put together a picture that really measures all of these different components. Next slide. like I said, there's lots of different sources of data. There's also lots of different types of data here, and they can come from many different places. They can come from looking at events over time. They can come from surveys using Qualtrics or SurveyMonkey. They can come from observations. They can come from audits and reports. And so the emphasis here is to really select the data elements that you're interested in, and then select the source. And the challenge right now is that we are trying to expand our data elements so that we're not merely looking at criminal justice outcomes, but maybe also looking at desistance outcomes having to do with employment and housing and education and well-being. And we'll get into that a little bit later. Next slide. So I wanted to put this up to basically suggest that, you begin when you're selecting your data elements to think about it from a logic model perspective. So a logic model perspective, and I'm sure everyone here has heard about logic models since, they're pretty common. A logic model perspective basically looks at the inputs into a program, the set of activities and processes that occurs. And then we have a series of different types of outcomes. So we could have outputs that have to do with, implementation issues. We could have outputs that have to do with more proximal outcomes, knowledge gained, changes in attitudes and beliefs, or we could have longer term outcomes like recidivism, well-being, functionality. So you notice on the slide, the darker blue areas here, in inputs, it's resources and personnel and client characteristics. Those may be in your administrative data sets. You'd have to confirm this because it all depends on your jurisdiction. But usually some of the other inputs that make a difference, like credentials and partnerships and regulations and policies, those are usually not in the administrative data. So those are gaps that you really have to fill in. Now, in process and activities, we often will have case management data and some program activity data, but we may not have grant or workflow information. In fact, a lot of new grants have to establish a way of putting in a code to indicate that this is a special program or service so that they could pull out that data specific to the clients that are participating in that particular program. As I said, we have a series of different types of outcomes here. We have outputs. Typically, outputs look at the numbers of people who participate. And sometimes, if you're lucky, they'll give you some ideas about fidelity. Those usually you can get in some aspect. And, we're going to talk about fidelity a little bit later on. And then proximal outcomes are usually organizational outcomes that typically we have to get those from surveys or systematic observations. And then the well-being outcomes or the longer term outcomes, recidivism and well-being and functionality, oftentimes you can get some version of those within your administrative data set. But while you're deciding what variables you want, what data elements you want, it's really useful to map it onto a logic model so that you can basically see where certain things are coming from and where they're not coming from. Next slide. Okay, so I wanted to sort of start with what type of data are you collecting that might be considered implementation data. So in the chat box, Robert V. Hawk, I apologize, Robert, if I mispronounced your last name. You said you were interested in the concept of implementation effectiveness because it helps us really think about, whether or not a new idea fits within a jurisdiction or you can obtain some fidelity. Do you want to elaborate on that at all?
Yes, ma'am. Sorry, I was trying to hit my unmute button. No, I mean and I've had the fortune to be able to listen to hear you talk previously about concepts of fidelity and transportability, and in listening to this is the piece that I think ties all of this together when you're looking at not only how can we show that the program was effective from the participants' perspective, but from the other side, so that if we're looking to do something like scale or sustain, those things are there, those pieces are there. And what's great about what you're saying is on one of the projects that I'm currently on, where we were looking at Medicaid data, we were looking at, what our local government entities are bringing in, what administrative data we have, as a way to tell more of this story. So that's it. I'm just really, I'm geeking out on this conversation in general, because this is right on brand, and right on the path that we're going on. It's just nice to know that it's something that makes sense to other people as well.
Okay, thank you for the feedback. That's great. Yeah, so, it is part of, and I'm glad you brought up the transportability. So for those of you who aren't familiar with that concept, the idea of transportability is that an idea you get from another jurisdiction or something you've read, and now you're trying to transport it into your setting. And you have to make adaptations to basically make it align with your settings. What happens there is, from an implementation perspective, we're concerned about whether or not there's a fidelity to what you have transported and how it's been transported. Because again, going back to what I said from the beginning, the larger issues that we confront are actually issues related to fidelity, or as the great Robert Martinson, sorry, said many moons ago, the issue isn't nothing works. Sometimes the issue really is nothing's implemented. And that's why these implementation fidelity design, implementation effectiveness designs are so critical, because you can actually ask the question, was something implemented? And if so, did it have enough oomph there to actually produce some of the results that we would like? Okay, so we have a couple other, Jody Morgan basically says that in her jurisdiction, they're collecting the dates people attend or miss treatment appointments. So those are events datas. The number of visits with a peer supporter, and that's also a process issue. The resources that clients get, so those are again process issues. And then outcomes that you are doing, Jody, have to do with graduation from your specialty courts or dockets, and whether or not people had some sort of neutral or unsuccessful termination. In other words, they would be classified as a success and employment status. So you've got a mix there of what you're collecting. And if we went back to the logic model, that would you could probably fill that out quite easily. So congrats on being so comprehensive in terms of how you guys are thinking about the data that you collect from your particular jurisdiction. Anyone else want to talk about some of the data?
We have one from Marianne Fay, who's looking to collect restitution data stats for JRA. I'm not certain what JRA acronyms stand for. Marianne, if you can chat what the definition of JRA is, but overall looking to collect restitution data and stats for JRA.
Hi, yes, I'm sorry, Demetrius. I was trying to find my unmute button as well. So the JRA is the Justice Reinvestment Victim Act. And we right now it's we're trying to figure out what would be a good way to implement that so we can collect restitution more effectively for the victims.
Yeah, so I don't know where you are. In many states, restitution payments are usually centralized at the state level and not necessarily at the county or local level. And so the question would be, would you be able to get those kind of funds, that kind of data from your state institutions?
Right. And I'm sorry, I didn't mean it. I was just looking over this. So I'm right now at the governor's office on crime control, prevention, youth and victim services.
Uh-huh.
And I'm in Maryland. And that's kind of what we're doing. We're trying to work with different entities within the state of Maryland to see what data they're collecting, as far as what percentage of restitution has been paid back. Also from like parole and probation, that's another agency we're working with, Department of Juvenile Services. It's just a different list of different branches we're trying to get that information for, with the hopes of getting a restitution court started, or at least a pilot program.
Uh-huh. Yeah, and so I think what you're uncovering is the data might be there, but it may be fragmented. And so doing a map of your systems and who has what type of data is usually necessary. I mean, unfortunately, a lot of the systems that have developed over the last 40 to 60 years, they've done one piece of some of the puzzle we're trying to complete here. And so people do have to pull things across different systems, as you found out, Marianne.
Yes, for sure.
Yeah, and we'll talk about this later, but the biggest issue is having a common enough identifier so it's easy for you to link the data from one source to the next. And that's a big challenge.
Yes, for sure. Thank you for that. I appreciate it.
You're welcome. All right, so let's keep going. Okay, so there are various types of measures that have to do with the program. So one issue is at the client level, which is the date people start services and the date people end services. So you get a length of time that someone's in services. Then there are the program level data, and that actually has to do with whether or not you are collecting data on which features of the program someone's actually involved in, maybe a measure that might have to do with to the degree that someone has actually participated in the program, number of sessions they participated in. I see that Catherine Rono, now again, if I mispronounce your last name, I apologize, Catherine. She's talking about collecting data on engagement. So engagement can actually be both a program and individual level, because you're looking at how many sessions something is offered, but then also the question about how many times did a person go to those sessions. And then we have something called fidelity. So what fidelity is fidelity is really about how much of what you've put in place matches what the program design is. And this is typically where transportability is a little bit of a challenge here. Because oftentimes when you're adapting a program, you may do things. So typically, for example, you might have, like thinking for a change or some other curriculum that's supposed to be 22 or 24 sessions. And then people actually say, okay, well, we're just going to do 12 of the 22 because that just fits within our time frame. Well, you've introduced a fidelity issue there when you make those decisions because you're actually changing the dosage of the program overall, which may have a pretty big impact on the outcomes. So you really have to think about the types of measures that you're using and also begin to tease out, are you measuring things at the individual program or fidelity level? Next slide. Okay. So I wanted to give you an example of how to measure fidelity. And this is in a paper that some of my doctoral students and I did a couple years ago. It's available online. And what we wanted to basically do is really look at the fidelity using the administrative data. So essentially, we were using the risk and needs assessment tool that the agency that we were working with uses. And so that tool is called the LSIR. This is for illustrative purposes. But what we did is we basically began with something very simple, which is to identify what was the average score on the LSIR, the total score, and then based on that, what percentage of people in that jurisdiction were classified as high, medium, and low on the particular score. We needed that because we wanted to look at the fidelity of the risk and needs tool with the case management plans for each of the clients. So we repeated this exercise to basically look at each component of the LSIR, like the employment, financial, families, accommodations, peers, drug and alcohol use, emotional, mental health, and attitude. And you can see in this table 1 here, we reported the average, and then we also reported the percentage of people that fell into the high, medium, and low areas by category. Again, this was to help us then move to the next part of a fidelity measure, which was to look at what was in the case plan. So what we were thinking of here was that, and I'm just going to use the employment because it's the second line, is that, you basically had 57% of almost 58% of the clients classified as high need. And what that means is we would expect to see employment as something in the case plan, either in terms of training people or in terms of helping people secure a job or in terms of, some sort of job training issues. And then we would expect to see 24% have sort of medium need for employment. Again, that would set the tone that we would think that those clients would actually need some type of assistance. And then 18%, scored low on the employment area, and therefore they didn't really need that assistance. So the first part is we basically looked at the instrument scores and got a sense of who was in the high and medium categories and for what sort of issues. Next slide. Next slide. Thank you. And then the next issue that we wanted to look at was how many people were placed into different types of special conditions as a result of the scores that they got. And you could see here, I'm going to go the second line, we had a very small percentage of people that actually had a special condition for employment and education. 47% had a special condition, and yet, and the majority of those people were actually at the lower risk level. So if you believe in the R&R framework, those lower risk people were being asked to do employment and education, whereas people who were in the higher risk level were less likely to be asked to do that. So that became a fidelity issue in the sense that, there was not necessarily an alignment between the risk to recidivate and the special condition and the conditions. And also we captured here that there were a number of people who had special conditions assigned by the court, and those seemed to take precedence over the alignment between the LSIR results and what was actually in the case plan. And we did this for all sorts of types of programs and services that were used. So you could see this here. Next slide. And then we went into the case plans themselves, and we basically found that 66% of the sample were actually in the medium to high need area for employment, yet the LSIR case plans integration resulted in only 24% of the clients overall being having a condition in their case plan regarding employment. And essentially, we use the column that says LSIR integration in case plans as a way of basically seeing whether or not the agency was implementing the instrument and case planning with fidelity. And you could see here that, employment was 24%, substance use was 67%, so there was a greater adherence here. Emotional and mental health was 21%. Less adherence to the needs of the clients. Peer support was 10%. Also, fewer adherence to what the needs of the clients are. Accommodations were 0, meaning that, none of the case plan essentially addressed the accommodations issue, and attitudes were also 0. So you could see how we were able to use the data in the system to think about, how am I going to measure fidelity? Now, the reason I wanted to show this to you is because many of you probably are capturing some of the risk and needs assessment information, and you might begin to think about how could you use that to look at the implementation integrity of your particular program. We use this with the agency that I'm addressing here. We use this to basically show them areas in which they needed further training for staff to understand gaps in services that might exist. And then they had a couple rather high-profile negative events. And so we use this as a way of saying you might be able to do some Sentinel event reviews. For those of you who don't know what Sentinel event reviews are, those are essentially reviews of cases that go sour. And you really want to try and find out what happened here and how could we actually make changes. So this is an example of how you can use administrative data for fidelity purposes. Next slide. Now I'm gonna switch gears now to talk about one of my more favorite topics. I'm sure some of you may have heard me talk about the cascade of care. So the cascade of care is a technique that's used within health services to look at the question about, are people in particular areas getting the services they need? So in this particular graphic, Steve Valinko and colleagues essentially identified in the kind of brownish area, these are justice system activities. The purple areas are transition activities, and the blue areas are actually treatment activities. And you could see here with these boxes that says missed opportunities for identification, that both in the screening and full assessment and in need area, we have considerable number of people who have a missed opportunity. And that has a greater effect later on in the cascade in terms of who gets referred and who actually begins treatment, then who stays engaged in treatment, and who continues in treatment. So the cascade of care provides a pictorial way of looking at how individuals flow, but it's really focused on your system. Now, in many areas, you can do this cascade of care by basically using your administrative data, but sometimes you have to link that data with other data sources, like with your behavioral health system or some of other organizations. But this is a really well-advised tool. A technique that really gives you a picture of how well is your system doing, and also can help you identify gaps in services. Next slide. So Mike Dennis, who's at Chestnut Health, basically wrote an article that's online in federal probation that basically talks about, for each of the steps in the cascade, how would you define those steps with administrative data? So in this particular case, he's talking about the fact that, the first one, referrals, has to do the number of youth that are intake into the juvenile justice system. The second part, screening, is the percentage of kids who actually are screened for having a particular record. And he shows you the calculation here is screening over referrals. And then C is the number of referrals that actually have a clinical need. In this case, it's for substance use. You could do this for suicides, mental health issues, educational deficits, anything. And essentially, Mike is providing with the logic behind each of the steps of the cascade, and then how you might want to calculate that. Next, I'm not going to go through the rest, but the slides are available. But I thought this was a good resource. Next slide. So in that particular study, Gail Wasserman and others essentially looked at the results from 33 juvenile justice agencies and basically found that it took on average, from when a youth came into the juvenile justice system and was screened to actually referred to a treatment program, an average of 26 to almost 60 days. So almost 1 to 2 months. Then they calculated the rates of different referrals. different steps in the process. So you could see that 71% of the youth were screened, in this case for substance use. 39.8% were found to be positive in need of some sort of treatment. And then 51% were actually referred and 9% initiated. And of course, this all occurs during this 30 to 60 day issue. So you have a couple things that we're learning here. We're learning that not all kids who screen positive are referred, and not all kids that are referred. So that's an implementation issue, but not all kids that are referred show up at the treatment program, which is a client issue. And so this type of data from the cascade can be used also in the issue about implementation effectiveness. Next slide. So, I've been working with CSG for quite a number of years. Essentially, we have mapped some of the different interfaces to really help you come up with different types of administrative data that could be used to be able to really, characterize what's going on in your system. And so this is, a vertical version of the sequential intercept model. Next slide. We have a document that myself and some of the colleagues at the Council of State Governments did almost 6 years ago, called Process Measures at the Interface Between the Justice and Health System. And we identified 2 types of system level measures. Again, these would be considered implementation measures. And then we identified 2 types of client level measures that would be considered client effectiveness measures, right? So we're giving you in this document, and it's online at CSG on their website, we're really giving you a way in which if you come up with some of these measures through your system, you can actually do a implementation effectiveness method of looking at how your system works. Next slide. And so just like Mike Dennis, sorry, wrong Mike here. We also provide definitions on how you would calculate each of these different measures. So here on this slide, we're giving you information on how to calculate the system level measures for set 1 and the client level measures for set 2. And the document actually has information in there for all 4 of the different groups. Next slide. Yep, and there's set 3 and set 4. Again, trying to provide you with the types of measures that would be useful for you in your system to think about how you're doing. All right, next slide. All right, so those are 2 ideas. The fidelity measures is one, and the second one that we wanted to share with you is actually the interface measures, which can be used for both implementation and client outcomes. We wanted to make you aware of the Justice Counts new initiative that CSG has joined together with all 50 states. And the purpose of this initiative, and the reason we're alerting you to this, is hopefully in your own jurisdiction, you can encourage your leaders or yourself to become part of this initiative. But the notion is that we need to improve administrative data. And to be perfectly honest, most systems have data systems that are anywhere between 20 to 40 years old. And so there's a new generation of data elements and systems that we should be looking at as we define what we want to know about how our justice system works. So Justice Counts, and Demetrius has put the website in the chat box for you. Next slide. So what's really nice about the Justice Counts is, the team that's working on this has defined metrics in all of the different components of the criminal justice system, criminal legal system, from law enforcement, prosecution, defense, courts and pretrial, jails, prisons, and community supervisions. And they also have some new subcommittees to look at behavioral health issues, which is dear to all of our hearts, right? That's why we're here. Reentry issues and victim services. So, there's a lot of wealth on the website that Demetrius provided to you. Next slide. And essentially, in each of the domains, they have about 6 different areas that they are recommending that data should be collected. So the capacity and cost areas have to do with process issues. Population movements could be very useful in the cascade of care. The operations and dynamic areas are very useful for process issues in that logic model. Public safety is very useful in terms of thinking about client level outcomes, and equity and fairness are extremely useful in thinking about proximal outcomes that have to do with the quality of your criminal legal system. So, they've applied these same 6 topic areas to all of the different domains, as we'll see on the next slide. Right, so this is a busy slide, but it basically allows you to look at each tab and see the type of data that they are currently recommending that should be collected. I'm not going to go through this. For those of you who will get the slides, you'll be able to look at this yourself. But what's really nice is they are providing some standards for the types of data that might be useful. Next slide. So the reason I wanted to mention the Justice Counts is because it's an opportunity for you to compare your current system with efforts to standardize data collections across the system. And so, if you're being asked, which I hope many of you are, about how to improve your data systems, you have a resource there with Justice Counts. I also would highly recommend, though, that you consider other types of process measures that are not currently on the Justice Counts, but is very critical in this cross-section between the justice and health systems. And those have to do with the screening tools and results from screening, referrals to agencies, treatment initiation, and treatment outcomes. Now, a big issue, and I alluded to this earlier, is a common identifier to link data from one system to the next. Typically, most places do not use Social Security numbers. There's usually a lot of concerns about we don't have a national identification system here in the United States. And so many times your systems need to think about what could be a common identifier. In many jurisdictions, it is often an algorithm that gets calculated based on like date of birth, gender of the particular person, maybe the location in the city they live, and some other area. And essentially, you know, this way, by creating this linking method, you're able to measure across systems. So Robert has just put in the chat box that they're looking at how to link justice measures to social determinants of health. And that's where the Medicaid databases are very useful. But it's also possible that your behavioral health systems might also have some data on the social determinants of health in terms of, you know, housing stability issues, transportation issues, you know, how well the person is from a mental health perspective. Next slide. So this is kind of a rehash, but the linking data basically requires us to have strategies to define different types of linkage methods. And what we, you know, as I said, usually the first and last name, social security number, date of birth, gender, those can be combined in some ways through some algorithm that then makes it possible to link between one system and the next. I will caution you that there are some sticky data issues. And so, you know, you should have some discussions with your data people about the precision of the matching, whether or not, you know, the data, source data, like the social security number is correct or not. And so you have to sort of deal with those sticky issues. But the beauty of linking data is that it really enriches your capabilities here. And it serves to be able to give you both implementation and effectiveness outcomes for your particular programs and services. And Robert is pointing out that they're looking at the QRNG system, and that's agreed upon partners that helps facilitate some of these linkages. Next slide. CSG actually has a very nice checklist for building and maintaining data warehouses that actually helps you with some of these data linkage issues, and also gives you food for thought in thinking through how do you link your data with another system data. So I highly recommend that you might want to go to that resource. They provide a lot of information on a very technical and complicated issue, which is linking data across different sources. All right, next slide. All right, so I want to just point out a few other things. You know, we are so used to thinking about recidivism as the main measure. But there's a recent report that was released from the National Academy of Sciences that basically points out that our classical measures of recidivism have some limitations that we should be aware of based upon the source data. The other thing is that they highly encourage us to look at post-release success, not just the negative. So really the post-release success of individuals in terms of well-being, education, employment, housing, family, and social supports. And the reason they're suggesting this is that because this then gives us a better picture of how well the programs are working. And they have many suggestions in this report on how to think about enhancing your own measures. Next slide. So this is a drill down of some of the desistance type measures that they suggest we look at. And a reminder that, you know, the data we collect on recidivism is usually from a system measure of the decisions that the system did. So if a police officer decides to arrest someone, that person has an arrest record. But that same officer could deflect someone, and we would not know that because of the way our data systems. And that's why they refer to this, that, you know, the way we do recidivism is really a proxy for the decisions that are made by the criminal legal system, which is why they're recommending these other domains. Next slide. I did want to point out that in the interface measures, we actually did have some of these desistance and measures built in as a way of talking about expanding our understanding of the types of supports that people have in the criminal legal system. So we have measures for homelessness, housing instability, service connection, capacity for homelessness supports, and housing tendency. Next slide. Okay, so we're now coming to the discussion period of time. And we'd like to hear from you all on what types of desistance measures you are collecting and how you're handling data from various sources. So I think, Demetrius, you can unmute people, right? Okay.
Yeah, if you have a question or want to discuss either of the two responses, then just raise your hand and we'll take you off, or drop them in the Slack, but we'll take you off and then acknowledge you and then have you speak. So feel free now.
Has anyone broached the desistance type of measures? Well, I highly encourage you to do that. So I think, Demetrius, people are pondering great thoughts. And you know, it also looks like a couple people are starting. Oh, we have someone. Marcia Edwards says, we are discussing for juveniles to capture first generation measures. First to go to college, first to get a steady job. Oh, those are awesome measures, Marcia. Do you have a lot of first generation, you know, clients in your programs? I guess she's not unmuted.
Marcia, feel free to, oh.
Go ahead.
I was chatting it, I was typing it, but I guess I can unmute. We've just started because we really think that recidivism is in a lot of ways a racist, you know, captured, you know, they're just, so much of it is tied to race and what your background, criminal history is. And we really wanted to tell a better story, that a lot of these are the first time they've graduated high school, the first time they've gone to college, the first time they've had steady jobs, is really much more positive, and it's more positive for the program, more positive for when people look, because we're so used to looking at recidivism, and it's really a very negative thing to look at.
Well, and that was the conclusion of the National Academy of Sciences, right? The issue with that report was that, you know, and I was part of the panel, so, you know, but we really had a lot of time talking about how the overemphasis on recidivism, but it's really not recidivism as much as it is the decisions that the criminal legal system makes. So again, if a police officer decides to arrest someone or deflect someone, you only get the arrest in the system. You don't get the other options. If a judge, decides to accept a plea, you get the plea. And so I think what you're doing here is really thinking about, some positives that here's a group of people that have a new experience and look at the successes that are coming. And desistance is really a measure about life events that are designed to facilitate better outcomes. And better outcomes here are exiting a life of crime and also exiting a focus only on the negatives in someone's life. So great ideas, Marcia. Thank you for sharing. Emily also suggested they wanted to look at the social determinants of health and focus on the increases in stability. And that's really, again, some of the issues. So another problem with the recidivism measures, or most of our measures, is we do what's called a, yes or no, something happened. But, life is much more fluid. And, the question then becomes, has someone achieved more drug-free time than they've ever achieved? Has someone achieved more housing stability than they've ever achieved? And that's success in many ways. In the medical field, they measure time between events as a way of looking at how well a medical procedure works. So, for example, I have asthma, and my doctor will constantly say to me, "Oh, you haven't had an asthma attack in 6 months, a year." And what he's actually doing is saying, this is good that you had this increased time. We don't do that in the criminal legal system. We basically say, did you ever get arrested again? And that ever could be 5 years, it could be 3 years. And so changing our mindset can actually make a big difference. Let's see. We also have Roberts talking about telling a story of what led to a person to continue or end their criminal career is difficult to do. But there are ways of capturing that, Robert. There's a lot of podcasts out now where people will talk about, why did I stay where I currently stayed? And what made me want to be more successful and end my criminal career. And then Robert's also talking about using social capital measures. Actually, David Best, who is a researcher from the UK, he actually has a series of social capital measures that would be very useful for people to look at. And I can provide the information to Demetrius and he could send that out. And we are actually, on another project that I'm doing, we have a webinar from Dr. Best that basically talks about these reentry capital measures. So Dimitri, Alyssa would like a copy of the measure from the National Academy of Sciences. It's at the bottom of that particular slide.
Sounds good. I can share it. We also have Emily Wolf, who put a comment in Faye earlier, who said we look at SDOH over time and focus on their increases in stability over time. I'm not sure what the acronym SDOH is. Emily,
Social determinants of health.
Oh, I'm glad someone did.
Yeah. Yeah. So, and Emily, housing stability, staying employed longer periods of time, educational attainments, all of those. as social determinants of health, if you just look at things over time, it can give you an idea of stability. Again, using my asthma examples, the longer time period between events is usually an indicator that the person is making strides. All right, let's see. Okay, I will send you the David Best information, Demetris, and you can send around as well as with the National Academy of Sciences report. So let's move on to the next slide. So this is our question and answer period of time. So I don't know if there are other questions, comments that people have. I highly encourage you to look at the Justice Counts information and use that as a way of thinking about the quality of your own system's administrative data. It's a good resource.
So yeah, as Faye mentioned, we are now in the question and answer. So if you had any questions or follow-up what's been discussed in the PowerPoint presentation, please feel free to Slack it or chat it and or raise your hand. All right.
So Alyssa, I would highly recommend that you speak to CSG about thinking about how to host some of these ways of getting your stakeholders on board for these alternative measures. And maybe you could share this, webinar with them, and you guys could listen to it as a group and then have a discussion. That might be helpful also.
So as we have like 7 more minutes, so we'll give some folks time to ask questions. But as we let you ponder on questions to ask, we wanted to show you that this is the resources that we've suggested. I've dropped those resources into the chat, so you should have them readily available. But definitely check out those resources. The next slide includes both Dr. Taxman's and my contact information. Feel free to follow up with any additional questions if you have them. And then the last and final slide is just, if you haven't already, just a reminder to please join the Justice Center's distribution list to receive updates on announcements on webinars similar to this, as well as webinars and information to help with funding grant opportunities. So I'll pause there and see if any questions came up. Feel free to chat them or raise your hand, acknowledge you, take you off of mute. Yes, the presentation will be made available, Kimberly, and to others. All right, I don't think we have any further questions. All right. Thanks, Dr. Taxman, again for a great webinar.
Thanks.
It seems like people really appreciate the data and information, and it seems a lot. So they're still digesting things, but definitely will make the presentation available. And thank you, participants, for joining and your conversation. Thanks, everyone. Have a great day.
Thank you. And Robert, it was great that you gave us all those pointers and questions. So I hope to hear from people. Feel free to contact me. Thank you. Have a great rest of the day.
Thanks, Faye. Bye-bye,
Okay,
everyone.
bye.